Hello. In this video presentation, I'm going to be explaining how regenerative medicine works, its benefits, and how it may help you or a loved one. We have two different types of regenerative medicine treatment options. One is regenerative cellular therapy, often called stem cells, and the other is platelet-rich plasma, or PRP. There's multiple different applications or usage for regenerative medicine. We use it for orthopedic applications such as knee pain, shoulder pain, hip pain, joint pain, arthritis, plantar fasciitis, tennis elbow, neck pain, mid back pain, low back pain. Also for cosmetic and aesthetics, so wrinkle reductions, facelifts, scar reductions. Also IV therapy. IV therapy is only done outside of the country, so we have a place that you can be referred to in South America, and down there you can get treated for things like Parkinson's, multiple sclerosis, cerebral palsy, diabetes type 1 and type 2, autoimmune diseases, heart failure, COPD, liver and kidney damage or failure. So lots of different stuff, but that gets done outside of the country. And then, of course, hair restoration, the ability to help regrow hair. So let's just talk about first what is regenerative medicine. Regenerative medicine is a branch of healthcare research and it involves tissue engineering and molecular biology. So its purpose is to help grow our fixed tissues that get damaged in the body, things like cells, tissues, and organs, to get them to become how they were supposed to be or how they were designed to be in the body, so that you could actually have or restore normal function. So let's talk for a second about what are stem cells. Stem cells are pretty much neutral cells, meaning they're just kind of a blank slate. They have the ability to change into different types of tissues in the body. So if your body needs cartilage, it can change into a cartilage cell. If your body needs tendons, something for the tendon, it can turn into a tendon cell, or muscles, bone, joints. They also can make another stem cell just like them. Now, the cool thing is today doctors can actually use stem cells to help repair damaged or diseased tissues that you may have in your body. There are different types of stem cells out there. In the next slide, we're going to talk about what stem cells that should be used and what should not be used. So when stem cell research and use started, they used different types of stem cells, and they basically use today. At first, they were using embryonic type stem cells or fetal stem cells, and this had a lot of moral and ethical concerns for good reason. The other problem with these types of stem cells, the embryonic or the fetal stem cells that we do not use ever, is that they were what's called pluripotent. Pluripotent means they could change into many, many different types of cells. And these cells were hard to control. So they could actually produce different types of cells in parts of your body where you may not want them. They also were not accepted by the immune system. So our immune system would attack them and look at them as foreign invaders. So for doctors to try to use this, in many cases they'd have to actually try to lower a patient's immune system, which we don't want, just to get these stem cells not to be attacked by the body and have the body kill them. And the other thing is they weren't able to really be controlled, and they could grow things that weren't wanted to be grown in a certain area or ever wanted to be grown in a body. So fetal stem cells, embryonic stem cells, we do not use, and we do not use them not only for moral and ethical reasons. We do not use them because they're not the type of stem cells that we want nor that we need. The type of stem cells that we use are called mesenchymal stem cells. Mesenchymal stem cells are a different type of stem cell. They are often called MSCs, and MSCs are actually considered an adult stem cell. We get them from the birthing process. So when a mother is going to have a baby, let's say like in the United States it's a planned C-section, the doctors will ask her if they want, if they would like to donate the umbilical cord. And last year in 2018, over 1.3 million mothers actually donated their umbilical cord for this type of use. The mothers are tested to make sure that they're healthy and they don't have any communicable diseases. When the baby is healthily born and doing well, they take the umbilical cord and they test it to make sure that it's also safe and clean for use. Now, there's a part of the umbilical cord or something that wraps around the umbilical cord called the Wharton's jelly, and it's there and designed to actually protect the umbilical cord during the baby being grown inside of the mother's womb. It has a lot of good stuff in it. It has a lot of these mesenchymal stem cells and other types of things like growth factors, cytokines, chemokines, proteins, things that we actually need to help grow the body or building blocks of the body. So the no babies are harmed. It's a different type of cell, and these cells are also considered an adult stem cell. They're not embryonic, and they are not from the fetus. They also are what's called multipotent, meaning they can turn into several different types of tissues. The cool thing is the type of tissues that they can turn into are the type of conditions that we need to treat things like knees, shoulders, hips, autoimmune, arthritis, autism, Parkinson's, all of those kinds. So they only turn into the type of tissues that we need to treat the type of conditions that we're treating. They are also non-tumorigenic. So they're not known to cause nor form tumors in the body. And they also do not cause the immune system to attack it. See, remember, most things, anything that gets introduced into the body, the immune system will attack it. And it'll send T cells there to inject histamine into it and try to, anything that comes in the body, they'll try to kill it so it can protect. And so this is how your body protects itself. Well, anybody who's ever had any type of allergies knows that this histamine's not fun. It produces all the effects of like the watery eyes, the runny nose, etc. And the great thing is these mesenchymal stem cells are not viewed as foreign invaders by your body, so your immune system doesn't attack it. And we'll actually talk in another slide how it actually helps your immune system. So if your immune system's not going to attack it, that means that your body will not reject the treatment. Now, there's a few important things that these stem cells do. One is they help reduce inflammation. Inflammation is not our friend. Inflammation is absolutely not our friend. Inflammation is known to cause a lot of pain. So people with arthritis, people with a lot of times with knee pain, the reason that they're having pain is all the inflammation. So if you can lower inflammation, you can lower pain. The other thing is inflammation is also known to cause a lot of the major diseases that we actually see today in America and around the world. Arthritis. We have, the different pain, joint type of pains. It can also help, actually, believe it or not, inflammation is known to help cause or form or create cancer. Depression, believe it or not, dementia, a lot of different types of diseases, autoimmunes, are all really centered around inflammation. So we want to do whatever we can to get inflammation lowered in our body. These cells also help modulate your immune system. So unlike the other types of stem cells that had ethical and moral and medical reasons why they shouldn't be used, these stem cells actually help your immune system. So if your immune system's low, they have the ability to actually raise it up. So they can actually make it stronger. That's important because when you have a suppressed or immune system that's not functioning properly, you can actually get things like colds, flus, viruses. Believe it or not, there's cancer that kind of runs through our body all the time, and if our immune system kind of keeps it at bay. Now, sometimes our immune system overreacts, or it actually attacks our body, and depending on where or what type of how it attacks your body is really dependent upon the kind of autoimmune type disease that you may get. They also have the ability to reduce scarring. Now, one more thought on the immune system. Remember, these things modulate, or they give the immune system, when it's too high, it brings it down. When it's too low, it helps bring it up. If we have a healthy immune system, we usually have a pretty healthy body. They also help reduce scarring. So as we have accident, injury, slips, and falls, these, sometimes our body trying to rebuild itself or replace itself or fix itself can lay down scar tissue that can impinge normal function or normal healing. And they also help generate or regenerate things in our body. Now, the second that we're born, our bodies start to die on us. They start to degenerate. We start to have cell death. We lose millions of cells every few minutes in our bodies, and these things have to be replaced. The good news is that when we're born, we have a lot of these properties, so it can just these mesenchymal stem cells, as we have cells that die, they can basically just replace them. They also, we have to generate or grow a body. So when we're born, we need these mesenchymal stem cells to grow our body, to maintain our body, so replace the cells as they die, and also fix us when we have an accident, an injuries, a bump, a bruise, a scrape, whether it's small or a huge injury or a serious injury. These things actually help repair it, and they really, really work very, very well. Now, what happens is we use them and we lose them. So we use them when we have accidents, injuries, slips, and falls, and we can actually remember we're born with an inheritance. We're born with a certain number of these cells, and so as we use them up, they become less. As we age, they also decrease because we've using them up. The numbers decrease and they slow down. We're going to talk more about that in just a few seconds. We also use them to grow and maintain our bodies. So just to maintain our bodies and to keep it how it is, every time cells die and we use more of these cells to replace those cells, we also kind of grow them up. And they also produce less with age. And what I mean by that is when we're first born, they produce more building blocks, and as we get older, they produce less. Now, in the next few slides, we're going to talk about how all of this works. When we're born, we have the highest concentration of these mesenchymal stem cells. Remember, these cells help lower inflammation, they modulate the immune system, they lower scar tissue or eat up scar tissue, but they also help maintain or fix our bodies as we use them. They also help us grow our bodies. So when we're born, we have a very, very high concentration of these. One of these mesenchymal stem cells for every 10,000 cells in our body. So the second that we're born, we basically get our inheritance of stem cells. We get our number that we're going to have for our life, and they're in the highest concentration of one for every 10,000 other types of cells in our bodies. They are also the fastest when we're born. And what we mean by fast is they have the ability to double or differentiate every 20 to 24 hours. When a cell can double every 20 to 24 hours, it can actually create 1 billion cells or more than a billion cells in 31 days. Imagine that. One cell that can turn into a cartilage cell. Remember, it can turn into a tendon cell or a joint cell or a muscle cell. Also make another stem cell. One cell, if it can double, one becomes two, two becomes four, four becomes eight. If it can do that every 20 to 24 hours in your body, it can produce over a billion cells in 31 days. Now, if you've ever heard the story of would you rather have one penny that doubles every 24 hours for 31 days or $200,000 cash? Well, if you took the $200,000 cash, you really would have lost out, because a penny that can double every once a day for 31 days becomes way more than $1 million. It actually, if it goes from 1 penny to 2 pennies to 4 pennies to 8 pennies, starts out really, really slow. But as it gets to 200,000 pennies, the next day it's 400,000, the next day it's 800, 1.6 million, 3.2, 6.4, and it just keeps growing rapidly towards the end. And this is the same thing that happens with these stem cells. Now, when I told you earlier, and what we talked about earlier, is that when we're born, they have the ability to produce more building blocks. So they're able to, they have the highest potential, and they can make up to around 300 different types of proteins or things that help your body develop and grow and maintain itself. And and when we're first born and in the first part of our life, they can produce a lot more things than they can later in life. It's important that the stem cells are like they are, meaning in high concentrations, can double quickly and can produce a lot of building blocks, because it takes a lot of resources to grow our bodies. From going from a little baby to actually becoming a full-grown person, it takes a lot of that inheritance that we got. We're constantly taking and withdrawing from our inheritance, and we're constantly to grow our bodies, to fix our bodies, and even to maintain them. So to do that, we need a lot of these cells. We need them in high concentrations. We need them to be able to be fast in making more, and we need them to be able to produce a lot of different blocks. Now, by the time we reach our skeletal maturity in our late teens or early 20s, when we've grown our body, we actually have used up around 90% of these cells. So remember, when we were first born, we had one of these cells for every 10,000 cells in our body. Now we only have one for every 100,000 cells. It takes a lot of stuff to grow this body. The crazy thing is that we actually have to live the rest of our life off the remaining 10%. So imagine being in your early 20s, you're feeling good, you have all this energy, we feel invincible. If we get hurt, we recover fast, we move fast, everything's going good. But we don't even realize there's only 10% of our inheritance left. We've used up and burned through 90% of our inheritance just to grow our body. But if you think about it, it takes a lot to grow the body. There's a lot of bicycle falls. There's a lot of learning to walk. There's a lot of different sporting things. We use them and we lose them so much, and it takes a lot to grow our body. And we basically have to be able to live the rest of our life of only 10%. Now remember, these things help lower inflammation. They help modulate your immune system. They help reduce scar tissue, but they also help us maintain our life. So as cells die, they actually help make new cells. So they maintain us. They help us maintain our life. So by the time we reach age 50, remember in our early 20s we had about 10% left, one for every 100,000. By the time we reach age 50, we have only one of these mesenchymal stem cells for every 400,000 cells in our body. We've dropped a lot. Now these cells also only produce around 100 proteins at this time. Remember, when we were first born, they could produce over 300 of these proteins, or things that can help build our bodies. By the time that we hit age 50, that's all the way down to around 100 or less. That means we have 40 times, instead of one for every 10,000, now we have one for every 400,000. We have 40 times less ability to actually heal ourselves when we're sick. We have 40 times less ability to fix ourselves when we're broken or have injuries, or even to maintain our lives, meaning as cells die in our body, we have 40 times less ability to replace cells. So by the time we reach age 65, it takes around 60 hours for one cell to turn into another. Now remember, when we were first born, it only took 20 to 24. At 20 to 24 hours, if you do the math, one cell can produce over 1 billion cells in 31 days. When you're 65, roughly, it takes around 60 hours. And if you do the math on that, one cell can only turn into around 400 cells, only 400 cells in 31 days. So if we're using these cells to maintain our life, meaning as cells die, replace them, if we're using these cells to fix ourselves when we have an injury, it becomes very, very hard for our bodies to keep up maintaining our life as well as fix us when. Now let's look at somebody's life over a 90-year lifespan and kind of see what happens. When we're first born, there's not really much aging. The first 30 years, if we were to break that 90-year span into 30 years, 30 years, and 30 years, the first 30 years, there's not that much aging. We actually even grow our body in that first 30 years, right? So if we get hurt, we can fix ourselves quickly. There's not that much aging. We haven't really started to wrinkle. We're pretty healthy, and things are going pretty good. The next phase, the next 30 years, from ages 31 to 60, we really start to see the effects of aging, or we really start to see our bodies not only slowing down, hair starts to go gray, hair starts to fall out, wrinkles appear, we start to slow down, meaning we don't move as fast as we used to. But not only do we not move as fast as we used to, we don't heal as fast as we used to. We start to notice aches and pains. We start to really notice the aging of our bodies between ages 31 and 60. And it just, aches and pains, things slow down, healing slows down. Now, by the time the ages 61 to 90, we really see the aging process accelerate. And we start to have more and more degeneration. We start to have more aging. We start to have a lot more aches and pains. And we start to really have the ability to not only maintain our life, meaning the aging is speeding up, but it really becomes hard to fix our. The reason is because when we were born, we had a lot of regenerative medicine. Now, we believe that regenerative medicine is really the future of healthcare. What we basically do when you have a problem, we take these healthy young cells that we get from the birthing process, from that Wharton's jelly, we process them, we make sure that they're safe, and we transplant them into the area of your body where you need them. And this is like the first time in your life where instead of taking money out of your regenerative account, we're going to actually make a deposit. And the deposit that we're making is going to be a high volume of these regenerative properties like the mesenchymal stem cells and the other growth factors that have the ability to get your body to actually act like it was younger, meaning your regenerative properties in your bodies, it can actually get them to act younger and get them to help produce more, grow more, and actually help you get better by helping the transplant actually helps your body, the resident cells in your body and the resident properties in your body actually be able to give it enough force and enough strength to fix itself. So we believe that healthcare, the future of healthcare is regenerative medicine because we could actually help your body fix itself so that it becomes back to normal or how it's supposed to be. Thank you for taking the time to listen to this presentation. If you have any questions at all, make sure that you contact us and we can send you more information or even set up a consultation, a free consultation to give you more information and answer any and all questions that you have.